The study looked at calls between 2017 and 2018. There were 142 of them for trespassing or an unwanted person. Of those 142, 42 involved people who clearly showed or expressed a mental health condition. The calls to police came from hospitals with emergency departments. That's here at Good Sam, also Legacy Emmanuel, Providence Portland, OHSU, Adventist Medical Center, and Unity Center for Behavioral Health. And in a lot of these cases, the hospitals wanted police to remove and arrest the person, not because they were causing a disturbance, but because they were asking for help and refused to leave.
To criminalize that behavior just feels like a really telling example of how stigmatizing mental health conditions still are, even in our healthcare settings, and how far we have to go as a community in terms of decriminalizing mental illness.
The study also found that people who were homeless at 72% and people of color at 35% were more likely to be arrested for trespassing at a hospital. So what does Disability Rights Oregon want to see happen? It wants a change in procedures dealing with marginalized communities, including those with mental health problems, more resources to make those procedures work at hospitals, and long-term help from providers for housing and other care. Legacy Health just put out a statement saying in part, quote, "Our services are available to anyone seeking medical and/or behavioral health services. Our priority is to provide a safe environment for patients, families, and visitors in order for staff to provide the care that's needed. Anyone who is a threat to safety or anyone acting in a way contrary to a safe, healing environment by demonstrating violent or unruly behavior will be asked to leave the premises and a trespass may be issued." And Providence Health also shared its concern for this issue and told us some of the ways that it is working to do better. But this watchdog advocacy group says not enough is being done, and there's certainly more to do. Brenda, back to you.
Thank you, Tim.